What is diabetes? Diabetes is a disease in which the body does not produce or properly use insulin. Insulin is a hormone produced by the pancreas to control blood sugar, and it converts sugar, starches, and other food into energy needed for daily life. How does diabetes impact an individual? Over time, diabetes can lead to blindness, kidney failure, and nerve damage. Diabetes is also an important factor in increasing the hardening and narrowing of the arteries, leading to paralysis, heart disease, and other large blood vessel diseases. What are the causes of diabetes? Deficient production of insulin, or the inability of the cells to use insulin properly and efficiently, leads to diabetes. The causes can be due to genetic factor, irregular lifestyle, environment factors. What is type 1 diabetes? In type 1 diabetes, body no longer produces insulin. Insulin helps sugar to move from blood into body cells. Cells need the sugar to give energy and keep the body healthy. If the cells do not get the sugar that they need for energy, blood sugar level becomes high. Diabetes is the medical term for people with high blood sugar problem. People with type 1 diabetes are advised to take insulin. Most people with type 1 diabetes are children or young adults, but it can happen at any age. What is type 2 diabetes? With type 2 diabetes, body does not produce enough insulin, or the insulin produced by the body is not properly utilized. Much of the food consumed is changed by body into a kind of sugar, which is also known as glucose in medical terminology. Insulin helps sugar move from blood into body cells. If there is not enough insulin to move sugar from blood into body cells, the amount of sugar in the blood goes up. When blood sugar level stays high, it leads to diabetes. Type 2 diabetes is more common in adults, but the number of children and young people with type 2 diabetes is growing. Eating healthy foods in the right amounts and being physically active can help people lower their blood sugar. Most people with type 2 diabetes take diabetes pills, while many also take insulin. Diabetes cannot be cured, but can be controlled. What are the symptoms of diabetes? The symptoms of diabetes are excessive thirst, excessive urination, hungry all the time, tiredness or feeling sleepy a lot, numb or tingling of hands or feet, wounds that won't heal, vaginal infections, problems having sex, blurred vision, sudden weight loss. Inform your doctor if you have any of these problems, especially if you have them for a week or more. How does your doctor arrive at a diagnosis of diabetes? The fasting blood glucose or blood sugar test is the preferred way to diagnose diabetes. It is easy to perform and convenient. After the person has fasted overnight, that is, at least 8 hours, a single sample of blood is drawn and sent to the laboratory for analysis. This can also be done accurately in a doctor's office using a glucose meter. Normal fasting glucose levels are less than 100 milligrams per deciliter. If fasting glucose levels increase more than 126 milligrams per deciliter on 2 or more tests on different days, then it indicates that the person has diabetes. A random blood glucose test can also be used to diagnose diabetes. A blood glucose level of 200 milligrams per deciliter or higher indicates diabetes. How can diabetes be prevented? Learn about diabetes. Even if a family member has diabetes, you can help prevent it. Eat whole grain foods like brown rice and dal. Fruits like apples, guava, papaya, watermelon, and green leafy vegetables like spinach and cabbage. Eat less fried foods like junk foods such as potato chips, pani puri, vada pav. Avoid eating high-fat foods like meat, pizza, and cheese. Lose your weight. Be active. Walk daily. Play and exercise. Stop smoking. Get tested for diabetes. A diabetes test is quick, easy to take, and low in cost. Possible complications of diabetes. Diabetes can cause blood vessel disease in eyes, kidneys, nerves, heart, leading to heart attack, paralysis, and pain in the lower body due to low blood supply. Tips for good eye care. High blood sugar levels from diabetes can cause a number of problems with your eyes, such as blurred vision, cloudy vision that feels like you are looking through a dirty window, an increase in eye pressure, loss of vision. Prevent eye problems by examining eye once a year. Keeping blood pressure under control. Keeping blood sugar under control. Tips for heart care. A person having diabetes has at least twice the risk or chance of having heart disease as compared to a person without diabetes. You can lower the chances of heart attack, stroke, or blood vessel problems by controlling blood sugar levels, blood pressure, cholesterol, weight, and by avoiding smoking. Tips for renal care or kidney care. People with diabetes have a higher risk or chance of having kidney disease. Problem with kidneys can cause serious health problems that are hard to control. Kidney disease is also called a hidden health problem because there is often no sign of a kidney problem until it is too late. Kidney problems can be prevented even before they start in the following ways. Control blood sugar. Control blood pressure. Be active and eat healthy foods in the right amounts. Have a urine protein test once a year. Control your weight. Stop smoking. Drink 6 to 8 glasses of water every day. Take proper medication as advised. Tips for good foot care. Check your feet and toes daily for cuts, bruises, or swelling using mirror. Wear shoes and socks that fit well. Use skin lotion to avoid dry feet. Exercise every day for at least 20 to 30 minutes. Wash and dry your feet every day. Use warm water and mild soap. Consult your doctor if your feet are injured. Avoid walking barefoot. Tips for a healthy diet. Avoid high sugar foods such as sweets. Avoid high cholesterol foods such as junk foods like burgers, pizza, potato chips, vada pav, pani puri, and oily foods like samosa and paratha. Ghee must be avoided. Switch to healthy vegetable oils. Avoid overeating. Take healthy diet like whole grain foods such as brown rice and dal, sabudana, whole wheat and brown bread. Low sugary or low carbohydrate food like fruits such as apple, watermelon, papaya. Green leafy vegetables like spinach, cabbage, sarson, methi and palak. Use atta instead of maida. And follow the diet as suggested by your doctor. Tips for weight loss. Being overweight and having diabetes increases the risk or chances of having other serious health problems. Lose weight by burning more calories by following the simple ways like eating slowly, avoiding skipping of meals, measuring the food consumed, eating 5 to 9 servings of fruits and vegetables a day, drinking 5 to 8 glasses of water daily, skipping snacks, and staying active. Tips for exercise. How to be fit. Exercise every day for at least 20 to 30 minutes. Be active. Perform yoga, stretching exercises, or free exercises as suggested by your doctor.